So we're going to be, it's called nasotracheal suctioning. So we're suctioning this patient, but this patient does not have an endotracheal tube in or a trach. So we're going to just suction the patient. We're going to go through the nose, into the trachea, and into probably the right main stem is usually where you end up. Why do you end up in the right and not the left?
Because it's steeper.
Right. Because the angle is much sharper on the left, so it's more likely to go into the right. Or you may just end up hitting the carina, not go all the way in. But we're basically suctioning the upper airway.
The purpose of this is just to get rid of mucus, right?
Right. And this would be done in a patient that is unable to clear it on their own. Sometimes they're too weak to cough it up. Sometimes they're not really responsive enough to cough it up. So if they can't cough it up, we will suction them. Why do we need to get it out of their lungs?
So they can breathe.
Right. So thank you, is because if they are unable to, if there's a lot of mucus in their airways, they're going to have a difficult time breathing. They're going to have a difficult time oxygenating. It's going to increase their work of breathing. So they are trying to pull oxygen in, but they have all this mucus in their airways. So we're going to help them. So number 2, what are the complications associated with an invasive procedure such as suctioning? Well, remember, the lungs are sterile, so because we're introducing this catheter into the patient, we can also introduce bacteria into the patient. So we're contaminating the lungs. Patients can end up with pneumonias and things like that because of it. Also, when we suction out, we're suctioning out all the, or some of the air in the lungs, so the patient may have hypoxemia. So their oxygen saturation may drop while we're suctioning out. They may have cardiac arrhythmias. Cardiac arrhythmias, number one reason for cardiac arrhythmias is hypoxemia. So if I become hypoxic, I may end up with cardiac arrhythmias because of it, as well as hypotension. So a patient could become hypotensive while you do this. So first we're going to, I'm going to have you suction the patient. You're going to turn your suction manometer on 120, okay? And I'm going to first show you how to suction, and then we're going to talk about the suction catheter. So one, you want to make sure it's on 120 and you have suction. So have this laid out first, because once you get your sterile gloves on, you can't touch anything else. So I have it all ready. Okay, I'm going to open my suction equipment. I'm going to take out my sterile gloves. So open that up all the way. I'm going to open my gloves. Remember, this is my sterile field here. So before I put my gloves on, I'm going to put some lubricant on my sterile field. And again, don't touch anything. Just squeeze the lubricant out onto the sterile fields. But don't touch the package to the paper or anything like that. Now, once I have that, I can put my gloves on. And again, I'm only touching the inside of my glove. I can't touch the outside because the outside is going to remain sterile. Okay, once I have this glove on, I can touch the cuff on this glove. Okay, where's my thumb? These are kind of sticky. And if, like in my case, see how my gloves are stuck together? My fingers are stuck together. I can pull them apart because I have a sterile glove on. All right, so both my gloves are on. Now I'm going to grab the package with my non-dominant hand. I'm right-handed. So I'm going to grab the catheter. See how I'm holding the catheter? Hold it so you can control both ends of the tubing. See, now I'm going to be able to push it on. Now once I touch this hand's no longer sterile. Okay? This is my sterile hand. I'm going to lubricate my catheter. Okay, and insert it depending on which nair is free. If they have a nasogastric tube in their nose, you're going to go in the opposite nair. If you didn't have anything in either nair, it's just pick which one probably looks like the least damaged. So I'm going to insert it And again, I don't want to don't touch his nose. The only thing I can touch is the suction catheter itself. So if you feel, now it's a little more difficult on a mannequin because he's rubber and things don't slide down as smoothly. But you're going to advance it all the way down until either you cannot advance it anymore or you see a cough reflex or feel resistance. So if I feel resistance or a cough reflex, because if I feel a cough reflex, what have I hit?
Carina.
Carina. So if I see a cough reflex, good. If I don't and I feel resistance, I can't go anymore, or if I can't go anymore because I've advanced it all the way down. Now I apply suction and I pull it out. And again, I keep advancing my hand down the catheter because I don't want to pull it out and it to flip someplace and touch something and now it's no longer sterile. Now I wrap this up and I let him take a few breaths and I assess, do I need to suction again? If I got a lot of secretions, I'm going to suction again.
And you should see it there too in the little...
Yeah.
You should see
how
it.
much you have suctioned.
And it comes out green and brown, doesn't it?
Well, it can.
I've seen it.
Or it could be green, it could be yellow. Okay, I'm going to go ahead and go again. Again, keeping this hand sterile, touching nothing but the inside of the nair. Slowly advance it down. And like I said, there is a point on him that you feel like, and if you don't feel like you're going in, sometimes you have to adjust, just try to reposition it. So I'm going to advance it until I feel like in him, I think he's kind of, okay. And I suction all the way back. Okay, so you're going to suction a few times, keeping always this hand sterile until you're